Hello, Sharon Weinstein. Welcome to the Doing CX Right show.
Thank you so much, Stacy. It's a joy to be here with you today.
Oh, I'm excited for our conversation. And let's start off for anyone who doesn't know you. What do you do professionally?
I began my career in nursing, and I've used my nursing platform, my healthcare platform, to educate people in all areas of life, both domestically and globally. I've been enriched by the relationships that I've made, and I'm very joyous about it.
So, of all the different fields, what made you pick that one?
It picked me. I had a scholarship from the Philadelphia Public Schools to go to school. And frankly, I had grown up in a household where my dad said, learn to type, you'll never amount to anything. And I was thrilled to get that scholarship and have a future. It chose me.
Oh, I like that. Looking back in time, I asked this of all my guests, my favorite question, which is based on what you know today, what would you tell your younger 20-year-old self if you could go back in time based on what you know now?
I would just say, go for it. Don't ever hesitate to go for it.
Did you hesitate?
A couple of times, yeah, I second guessed myself. I had limiting beliefs, as we all do. And I realized that I needed to shed those limiting beliefs and really do what it was that I was meant to do.
That's definitely a strong one that many people will relate to. So, yes,
Okay.
I will. I believe people will ask a lot more questions around that. So, getting to the heart of this show,
Mhm.
you focus a lot on patient experience and healthcare. So, when I say doing customer experience right, what does that mean to you?
That's a great question because so many people don't get it right. It doesn't have to be in healthcare, it can be in any consumer space. Some people know how to do it, and some people just do not get it right. The people who do it right are the people like Nordstrom, who make anything happen. The people like Disney, where even though it's overpriced, they have people coming back for more because of that experience. So if it's a true experience that really engages with people and makes them feel valued and appreciated to be there, where the corporate culture and the values align with the people culture and values, that to me is the experience.
So, how does that relate to healthcare? And I know you have some books on that. Can you share what is the biggest problem causing frustration?
The biggest problem I believe today, and certainly based on the interviews that I've done with my co author in a book that we have coming out next month called Healing Healthcare, is the fact that we don't have enough providers. It takes too long to schedule an appointment. People wait too long once they get there, and they don't feel as if that provider, whether it's a physician or a nurse practitioner or someone, doesn't really engage with them and make them feel as if they are the most important person they need to see that day. You know, I used to work in a clinic and practice plan, and we were told we had 7 minutes to get patients in and out of a room. 7 minutes is barely enough time for anything. So if you're having 7 minute visits and you keep filling the schedules of your providers, there is no time for anything. You get more personal attention now on a telehealth call than you do face to face.
I hear that is very similar in the ER. It's this machine, this factory, and why is that? I mean, we're talking about humans.
I know we
There's
are.
nothing more important.
No. I always say, Stacy, that healthcare is a business like any other business. The difference is that commodities with which we deal are human lives and human happiness. You don't compromise that. This is not a tire on your car. This is not a dent in your hood. This is someone's health and body. And so when you look at the whole concept of emergency departments, and they frankly, I used to work in the ER, they can become the worst because consumers, because of limited healthcare reimbursement, use the emergency department as their quote family doctor. So if they come to the ER with all kinds of little issues with a sore thumb or a sore toe or whatever happens to have bothered them that day, the cold or the flu, that's taking up the space of people who might be coming in with blood pouring out of an extremity or a bone that is hanging by the limb. And so when we have that kind of a situation, we don't have enough providers the triage system does not work. And it becomes a situation in which people sit for hours. So I know, for example, from personal experience, that in many cities like Chicago and like in the Montgomery County where I live, you can use an app to tell you how long the wait time will be in an ER. And sometimes it comes up with things like 26 hours. Who wants to wait 26 hours in an ER to see someone? First of all, you can get a bad disease while you're sitting there. You could come home with something that you pick up just sitting there. And second of all, that doesn't cut it. So a lot of these doc in the box kinds of places, these urgent care centers that are not so urgent, have evolved and they keep evolving, but they're not really urgent. Many of them don't have x-ray equipment. They don't know how to place a splint. They couldn't place a cast if they wanted to. And so they're not true urgent care centers. We've recently in our family discovered a place here in Laurel, Maryland, that used to be part of a hospital, but they built a freestanding urgent care center that is a real emergency department that has real licensed physicians and practitioners from the healthcare system who are covered with their insurance by the University of Maryland. And they actually have real beds and units and systems, just like an ER. But when you need an x-ray, the x-ray machine comes to you. You're not going to the hospital's x-ray department and sitting out in a hallway and waiting and waiting and waiting because somebody needs an MRI and they might have priority. You're actually being cared for and you're doing it quickly. You can get in, you can get out, you can get care, and you feel confident. And you get a referral for follow-up care that is certainly within proximity to where you are. That makes perfect sense to me. I wish more hospitals would do it. But right now, our system is such that, I remember years ago waking up one morning between Christmas and New Year's when we lived in Illinois and saying, I'm going to the hospital. I have hives all over me. I'll get a shot of epi and I'll be right back. And I didn't do that. Instead, I stayed at the hospital for the whole weekend. I thought it was because I had two good forms of insurance and they didn't have any customers, if you will. And so I got admitted, but I had to do my own IVs because everybody was on holiday. I had to basically take care of myself. Fortunately, I wrote the book, so I know how to do it. But I was staying up for 24 hours monitoring the situation myself and talking to the Abbott rep about the pump and about what was working, about what wasn't. So this is not something new. This is something that has been ongoing. On the healthcare side, providers want to do their very best. But when you work in a system or a culture that doesn't really value its people the way that it should, your hands are tied. You can only do so much.
Ooh, culture. I mean, that's the thread to everything, whether it's hospitals, doctors, corporate. We're all saying the same thing, that culture really makes or breaks the experience. And I never really thought about it in the realm of life and death.
Yeah.
Nothing's not, nothing's more significant. So is your book, tell me about your book and how are these problems being handled, or is there the promise of hope or action
There
that
is a
people could
promise. There is
take?
a beacon of hope there. I'm glad you asked. I have lots of books, and they're generally about things like work-life balance or stress or the kinds of things that I've worked in for years. But about maybe starting in December of 2022, my colleague and I decided to convene a nurse leader listening tour. So we interviewed probably 50 or so nurse leaders from across the world. We wanted to know what they found as the biggest issues, what was the problem that they saw, what was the potential solution that they saw. We recorded all of those in LinkedIn on LinkedIn Live, and we posted them on the YouTube channel. But then we started to think a bit further. There were such nuggets of gold in what they said. The messages were so profound that we thought, what if we create this and put it into a book? And so we created something that we call Healing Healthcare, Evidence-Based Strategies to Mend Our Broken System, which is indeed broken. Some might say beyond repair, but it is broken. We divided that book into 3 sections. The first one is the workplace, because that is the force of all evil. And frankly, that workplace area could also apply to any kind of a setting. It doesn't need to be a healthcare setting. It can be a hospitality setting, any human resource setting. The workplace is the workplace. And if the workplace is not one that truly appreciates its people, they're leaving. There is no such thing as quiet quitting. They're making noise and they're leaving. And they're leaving, Stacy, because everyone does exit interviews, or they used to. No one does an interview and says, why do you stay? Why are you here? What makes you stay? And how can we share that message with others so that they too want to stay, or they want to engage with us and be a part of our community because it's a valuable experience? So we have the workplace. Then we have well-being. And well-being includes mindset, it includes mental health, it includes physical health, it includes something as simple as a biological break. There are times on a shift when people do not even have time for a biological break. They won't drink water because they're afraid they'll have to take a break. And so they walk around dehydrated. They can't concentrate on the computer screen because of it. And they spend too many hours on that screen. And they don't have the energy to provide the care that they should be providing simply because they're not well. And they're not well because the well-being of that organization is not front and center. It's just not. People don't care about those who are providing care. And I always tell people you cannot drink from an empty cup. So if you don't fill your own glass first, you won't be able to fill someone else's. There is a reason the flight attendant tells you to apply someone else's oxygen mask or apply your own before you help someone else.
Is this a leadership issue, or is this a individual not owning their experience?
No, it's a
Or
leadership
both?
issue. It all begins at the top. The third section is wisdom. It's the lessons that we've learned about the workplace and about well-being and how we can provide and align those lessons learned with what we know today about the situation. So it is not an individual situation. It is a leadership issue. It is about culture. It is about leaders. It's about values. It's about what people think is important. And obviously, not everyone has the same level of importance, if you will, or gives things the same level of importance as perhaps you and I might. They just don't.
Yeah. How do you make leaders care? And how do you get leaders to understand how this is essential? It's not a choice.
No, it's not a choice. And the interesting thing is, any organization you walk into, they always have a value statement or a culture statement or their mission or vision posted on a wall. What would happen if they took that thing off the wall and put it in the hands before the faces of those people who needed to read it most, who understood that whatever it said on the wall carries through to their everyday experience, and that in everything they do in every way, every day, they care about that experience. They care about the experience, not because in healthcare we want them coming in and coming back. We hope that we make them well and they don't have to come back. But the idea is one of engaging people. You and I both know that a lot of the business that we get comes from referrals. If you have a satisfied customer, they're going to tell someone. If they're dissatisfied, they're going to tell someone on loudspeaker. And everyone is going to know. They're going to post it on social media. The world will know how bad they were.
I love how you said on loudspeaker. I mean, that is so
They'll
truthful and
broadcast it.
real.
They will. That's
Yeah.
how it happens.
Yeah. So, actionable tactics for people listening, for
Mhm.
those in the healthcare and leaders of any organizations, what's your advice to them?
My advice to them is number one, engage. Make sure that when you schedule an appointment, that you're not squeezing somebody in all the time between someone else. And if they are squeezed in, that they recognize the fact that they may need to wait 15 or 20 minutes to see the doctor. But when they see the doctor, they will be the most important person that doctor needs to see. I have a physician I was referred to last year. I'll be honest, I couldn't even get an appointment with her and I wanted to see her. Once when I called, the receptionist told me that if you make an appointment with a nurse practitioner and spend a couple of hours with that individual, it'll be easier to make an appointment because you'll be a returning patient, not a new patient. New patient experiences are hard to come by. I made the appointment with the NP. I saw her for 2 hours. I thought she was absolutely amazing. And sure enough, the following week, I was no longer a new patient and I got an appointment with the person I wanted to see. When I got that appointment, I assumed that because I had an appointment at 10 a.m., I would be seen sometime between, say, a quarter to 10 and 10:30. That was within my expectation. And an hour and a half later, I was still waiting. There was one point when I went to see her and I said, I need to leave now. unless she can see me now. And if not, I'm out of here because I too have a life. And she did see me. But I will say that even though I often, and I know now to wait an hour and a half, or I know to take the first appointment in the morning, even though I'm waiting, it doesn't matter to me because when I am with her, I am the only person she needs to see that day. She is 100% focused on whatever my challenge might be and how she can help me overcome that challenge. And that makes you feel good. So you don't mind the couple of minutes wait or the 30 minutes wait or the whatever wait. You know, I used to go to a provider in Chicago who would say they would call you ahead of time and say, so and so went into delivery, or people are in delivery today. She's in the delivery room. You just have a regular medical appointment. Would you like to reschedule? I don't want you to come here and sit and wait. That's polite because that recognizes that the consumer also has things to do.
I believe that everybody has a customer experience job. So that example is perfect because that front office staff has the choice to make it better for you just through communication.
Right. And by making it better for you, they're making it better for the practice. They're making it better for everyone else who might have to wait.
So, to the contrary, I've been to doctors who are the best in the industry, and I will no longer go to them because that front office is not nice, is not respectful, is not delivering on the promise. And meanwhile, the doctor's great, but it doesn't matter.
Well, conversely, I remember years back when I had my first two children, I used the same neonatologist at a teaching hospital. He had written every book. He was as brilliant as they come. But he didn't understand that a neonate comes with parents. And so while he could care for the baby, because that was fine, there was no interaction, the baby wasn't going to know whether or not there was a relationship. He didn't know how to speak to the parents. And he was into shaming and blaming and a total lack of psychological safety. So every time that I had a child, or those first two times, if something wasn't right, the tumor was my fault. It was something I did in pregnancy. The jaundice was my fault. It had to be related to the breast milk. Everything was my fault. It was something that I did. And finally, the third round, when we had our third child, I said, I'm not using that doctor anymore. I don't care how many books he wrote. He has no clue as to how to speak to parents. And instead, I chose someone else, and everything went as smoothly as it possibly could because I felt respected. We felt respected as a family.
Mm.
It doesn't matter how brilliant and caring the person is. If they don't know how to speak to the family as a unit and know that there's more than just the baby or just the parent, and that there are siblings or sisters or sons and daughters and other people involved, you need to be able to provide family centered care. It has to be patient centric, and it's not.
So, talking about it's not and care and empathy, what's your view on technology right now and the trends where it's going in this story?
It's a joke. Everybody has a portal, and the portals don't talk to one another. So you might try to find as many physicians as you can or as many providers in the areas that you use on a significant portal and use only their system. But if one part of their system fails, you have to provide somebody outside their portal. And because the portals don't talk, it's the same thing as going to multiple providers and one not knowing what the other one is doing. And patients sometimes play those games. They'll go to one person and they won't tell them about the script they got from someone else because the portals aren't connected. So it's not a fault of the portal, it's a fault of the system itself. And that patients, unfortunately, find a workaround. If it doesn't work in their favor, they find another way to get what they need.
Even your story of systems and process. I mean, think about that you had to come in to the doctor already an existing patient, even though you hadn't been there before, but you had to do this whole workaround.
To become
And
a
that,
non new patient, right? To become existing, if you will. Otherwise, I didn't exist.
yeah. And it also was fluke that this particular person advised you to do that, or you
Yes,
may
she
not
told me to
have
do it.
gotten in.
Exactly. And I'm a nurse. So I should know. But I tell people that now. I say, if you can't get an appointment, see if they have an NP. And if you can make an appointment with the NP, then you'll be a returning patient. Then you stand a chance to be seen. But it shouldn't be that way.
No,
It
it should
shouldn't be
not
that
be
way,
that way.
Stacy. It's that way no matter where you are. In large teaching hospital systems, you talked about the ER previously. We had a family situation where a family member went to the ER and sat there for 23 hours without care, sick as can be without care. And I had to make a phone call to administration to get them out of the ER and into a bed. Because every time the family members who were with her kept saying, well, when will there be a bed? Well, can you call the unit and see if there's a bed? No one could do anything. No one was empowered. That, Stacy, is the good thing about Nordstrom. Everyone is empowered to make a decision. You don't have to go to your boss to find out. You don't have to get permission up to a certain amount of money to extend a credit, to extend some common courtesy, to hold the door open for another 15 minutes while that customer finishes their shopping, and even offer to carry their stuff out to the car. It's just a different mindset. If we had that mindset in the healthcare systems, it would be golden.
You're reminding me, I was at a restaurant and the waiter had dropped something that was very colorful on my white jacket and
Mm-hmm.
very empathetic, very apologetic. But the best part I noticed was that he didn't need to go to his boss on the spot. He was able to say, give me the dry cleaning. I'll take care of it for you. I want you to come
Exactly.
back, etc. So, yeah, this is applicable to every industry about empowering your workforce.
Right. The workforce needs to be empowered to rise up, step up, and make a decision, to speak out on behalf of management with a resolution that will allow people to feel satisfied, that will make them understand that they've been treated well and respected, and will make them want to come back. If they can't do that and they have to go up maybe 5 or 6 levels to get an answer, well, they say, well, I can't do that. I can't do that. I can't do that. And my stock answer when people say that to me is, please don't tell me what you can't do. Tell me what you can do.
And
What can you do? And they often say to me, I can do nothing. I have to go whatever layers up to find out what I can do. That's so sad. I worked with a woman last week when I was on a launch for a program, and she had said she's been in the healthcare industry for probably 30 some years, maybe more, maybe almost 4 decades. And she has been in every single aspect from manufacturing to plant management to this to that, everything. She knows how pills are made. She knows everything. What was interesting was she said that if you're working in a place that doesn't love you, it's not going to love anyone else. So be in a place that makes you feel whole. When that place makes you feel whole and you're excited to be there, you're grateful to be there every single day because you know that you are making a difference. That's the kind of a place you want to be in.
that goes back to culture.
It all circles back to culture, every single piece of it.
Now, measurements. In the corporate world, there are key metrics to know that you're actually providing a great experience. What is the equivalent? What do they do in healthcare?
In healthcare, they have scores, HCPCS scores, but I'm laughing because in business, it doesn't work in every business. Does anyone ever determine how long it's going to take at the Department of Motor Vehicles? What that experience is going to be like? So think about the bad experiences you've had, and maybe they don't have metrics. Maybe they don't have key performance indicators that indicate, did this go well and did it not? We have patient satisfaction scores. We have, thank heavens for Press Ganey, a marvelous organization that collects those surveys, that sends them out immediately, that hopefully people respond to. But it's not enough. It's really not enough. And those scores aren't the only thing that determines whether a place is good or bad. We all
Mm.
know that there are secrets everywhere, and that sometimes doctors or providers leave one facility and maybe move to another state because they've been banned from the first state and maybe the record doesn't follow them. There are all kinds of ways to monitor, but it doesn't mean that the monitoring is being done. I think that measuring patient satisfaction scores is a really good thing to do. I wish that there was a way to make it more personal so that it wasn't just a measurement that went into a survey that was done electronically, so that there would be some room for narrative. So, an example, I stayed in a Sheraton last week. They said, how was your experience? I was honest. I told them. I said, the hotel was fine. In my mind, it didn't measure up to Sheraton standards. There were 2 long black hairs in the bathtub when I checked in that didn't belong to me.
Ugh.
That means that there's a housekeeping issue.
Yeah.
Once when I worked in Florida, I remember checking a patient into a room, getting ready to start her IV, and there was a roach in the closet where she was going to hang up her clothes. And the housekeeper said, "Oh, don't worry, honey, he comes with the room." That is not an answer. The answer is not, "This is Florida, he comes with the room." The answer should be, "Let me take care of that immediately. Why don't you wait outside? I'll get you a cup of coffee or tea while you're waiting, and we'll do a deep clean on this room." That should be the answer, not, "He comes with the room."
Oh, we could talk for hours.
The stories over the past 35 years have been overwhelming. So, yeah, you could write a book just on the bad side of the patient experience, but yet there is a good side. There are people among us who truly, truly care, who want it to be a better experience, who want that experience to be exemplary, who
Yeah.
speak for the organization and represent that organization at the highest level, and who really care.
Yes. Well, last two questions, rapid fire here. If there's one key takeaway for people to remember, what do you want them to
One
think
key
about?
takeaway for me is make every experience count. Make it something that the people remember for all the good reasons, not the bad.
Hmm. And leadership, we know, drives the culture. What's the best leadership advice you've given or received?
That's a good question that I've given or received. Given is probably, you have the capacity within you to make this happen. Share that across the board so that everyone believes in the same purpose, that we're all here for the same reason. And then that I've received is, and I pass this on all the time, so it's sequential, make sure you're all singing from the same sheet music. Don't tell one version of the story and have somebody else tell another version. Make sure that everyone is singing from that same sheet music, that that same value statement that is up on the walls gets disseminated at every level of the organization. You know, a few years ago, I did a program on service excellence for a large hospital system, and they allowed me to select who would sit at what table, and they were rounds. And I said, I only want 5 or 6 people at a table, but I don't want them people who work with one another. I don't want them people who work in the same building. I don't want them to be that. I want them to be perhaps the head of housekeeping here and the head of mechanical engineering here and the person here, so that you were sitting with people you did not know. This was not the time to sit with your buddies. This was the time to learn how your department could integrate with their department, and collaboratively, you could do a better job. That was fun. It doesn't happen
Yeah.
often, but it was fun.
Yeah. Well, consistency and gosh, so much to unpack there. Thank you. Thank you so much for being on my show. And I look forward to sharing your words of wisdom with the world.
Thank you. The pleasure's been mine.